Great. Hello, everyone, and welcome to our TA Marketplace Vendor Fair. Today, we'll be covering domains 5 and 6, which are promoting health equity and supporting cross-sector partnerships. And we can go to the next slide. So my name is Jasmine Garcia. For those of you who don't know me, I am the Providing Access and Transforming Health Unit Chief at the Managed Care Quality and Monitoring Division at the Department of Healthcare Services. Our Project Coordination Section Chief is Shell Wong, who was unable to join us today. And also our Managed Care Program Oversight Branch Chief is Michael Weezer, who also was unable to join us. And from our third-party administrator public consulting group, we have Trish Perizzelli, our team marketplace lead, Eliza Met, our vendor services lead, Jenna Wall, our cross workstream lead, and Danielle Feldman, our team marketplace project manager. And we can go to the next slide. And so really our goals for today are to provide an orientation to the TA vendor fairs and showcase TA vendors and their services and projects, and also share the TA marketplace resources and some exciting updates, and open and really just leave some time for Q&A at the end for everyone. And we can go to the next slide. And so really, our purpose of creating these virtual vendor fairs were really just to have this opportunity for vendors to share information about their organization and services to potential TA recipients and support and really ramp up utilization of the TA marketplace. And so we've had, this is now our 5th virtual vendor fair that would be held. And originally we had the first in February, and now we're culminating with our last one, at least for the time being, across these 7 TA marketplace domains. And so if we go to the next slide, I'm going to pass this off to Jenna. Thank you so much.
Hey, thank you so much, Jasmine. So welcome, everyone. As Jasmine stated, today is the final in our series of these TA vendor fairs. So today's vendor fair is focused on domains 5 and 6. So we're going to quickly go over what those domains are. Domain 5 is promoting health equity. So vendors that are approved in domain 5 have the expertise to support TA recipients advance health equity through their implementation of ECM and/or community supports, and in their work with Medi-Cal members overall. So some examples of some TA services in this domain may include outreach and engagement of different minority groups and underserved populations, supporting the data collection and analysis for these populations, and just overall cultural competency. If we go to the next slide. We have domain 6, which is supporting cross-sector partnerships. So those vendors that are approved in domain 6 have the expertise to support TA recipients, engage in cross-sector partnerships, particularly partnerships with managed care plans and counties that you all will be contracting with for ECM and community support services. So examples of TA services may include just legal support for working with managed care plans on their contracts, designing and implementing care plans, and just really building up those cross-sector teams. So we have 29 vendors here today, some of which are only approved in domain 5, some in domain 6, and some that are actually approved in both. And they may actually be familiar to you from the other vendor fairs that we've had. So if we go to our next slide, just give a brief high-level agenda. So we've done our welcome and introductions. I'm going to go through just a few more logistics in the next following slides. Once that's complete, we'll have our 29 vendor pitches, which are those 60-second pitches. Then we will move to the breakout room sessions for a half an hour. And then we'll have some time for Q&A and just a quick overview of the TA marketplace and resources available to you all. We can go to the next slide, please. All right, so just to start off, some Zoom logistics. Please be sure that you are logged in using the Zoom application and that you are not on your phone or using a web browser to view this event. The reason for that is when we get to those breakout sessions, if you are not using the Zoom app, you will not be able to participate in those breakout sessions. So highly encourage you to rejoin this meeting using the Zoom application, which can be downloaded on the Zoom website. While we are in this main session, we ask that you use the Q&A functionality to ask any questions about the TA Marketplace, or if you're having any technical issues. We do ask that the vendor-specific questions, you hold those for your breakout rooms. Those breakout rooms are meant to be a time in which you can ask those very specific vendor questions, and the vendors are not able to answer questions in the Q&A. We just want to reserve that for general inquiries. Can go to the next slide. All right, so just a quick overview of vendor pitches. Next slide, please. So as I said, vendors will have 1 minute to present their organization. Vendors will be presenting in alphabetical order as they appear on the TA Marketplace. There are some, various slight name changes or differences. So they are how they appear on the website. And again, just ask that you please hold those specific vendor questions for those breakout room sessions. All right, so next slide, I think we have our first vendor, which is 43 Strategic Consulting, if you want to kick us off.
Great. Good morning. Thank you, Jenna. Good morning. My name is Catherine West, founder and CEO of 43 Strategic Consulting. I founded 43 Strategic Consulting because I believe that we need to do health equity differently, and that it's really important for women and people of color to be at the table shaping solutions. We are a collective brain trust with a proven track record in facilitating collaborative partnerships across diverse agencies. We know what's possible because we have been there on the front lines advancing equity. Our team includes practicing clinicians and experts in Medicaid, care management, value-based payments, primary care redesign, digital equity, housing, workforce, performance improvement, risk adjustment, and communications. We love working with housing organizations, FQHCs, and BH providers. Our commitment is to ensure that the organizations we work with improve their revenue to sustain their mission and impact. I invite you to join us in Breakout Room 8. We welcome the opportunity to co-design and innovate with you. Thank you, and look forward to seeing you in Room 8.
Hey, thanks so much. Our next vendor is Apt Global.
Hi, good morning. I'm Katie Sheedy from Apt Global, a consulting firm with a 60-year history focusing on improving the quality of life and economic well-being of people worldwide. We have decades of experience providing training and TA resources for a diverse array of community-based recipients across a wide range of topics, including housing TA to organizations throughout the state of California. Equity is a cornerstone of our organization. We've developed a highly flexible and responsive approach to designing and implementing training in TA and are available to support you across all 7 domains. In domains 5 and 6, we can support your organization's innovations to improve maternal health outcomes, develop resources and shared learning engagements for lived experts like peer specialists, doulas, and recovery coaches, and facilitate opportunities for cross-sector partnerships between housing providers, juvenile justice, education, and healthcare systems. I hope to see you in Breakout Room 7. Thanks.
Hey, thank you so much. Our next vendor, the next slide, is California Health Policy Strategies.
Hi, good morning, everybody. Gretchen Schroeder. I'm a consultant with the California Health Policy Strategies Group. We are a California-based consulting firm with a lot of experts in managed care. Excuse me, I'm having a hard time making up this morning. Dual eligibles and CalAIM. We have a staff of David Panish, Jane Ogle, myself, and Darren, who have a deep commitment to policies that will improve California's healthcare system for vulnerable populations. For this TA vendor fair, we are approved for domain 6, but we are also approved for domain 3. We do a lot of work trying to negotiate contracts between ECM and community supports providers and the managed care plans. We also do a lot of work on collaboratives. We're doing a street medicine collaborative right now, trying to bring folks together and figure out how to solve some of the contracting barriers that we're seeing between managed care plans and street medicine teams. So I'd like to do that work at the ground level as well as at the policy level to see how we can make changes to really get everybody the services they need. Thank you very much.
Thank you so much. Next slide. We have Camden Coalition.
Good morning, everyone. I'm Cheryl Mathis, Director of Technical Assistance at the Camden Coalition. Delighted to be with you today. The Camden Coalition is a direct service organization that also supports national collaborations and partnerships across multiple communities. We have been providing care management in our home Camden community for over 20 years, as well as working with communities across the nation and in California for many years, helping to drive thought leadership and development of sustained partnerships that address individuals that have complex health and social needs. So we have a combination of that on-the-ground experience, being a care management provider, as well as developing coalitions. We have multiple ways that we love to work with communities in a very hands-on way. Some examples here are through asset mapping. I'm thinking about community conferencing, and health equity is a core tenet across all of our service areas. So we look forward to seeing you in breakout room 6. Thank you.
Thanks, Cheryl. Next, we have Chorus.
Hi, everyone. My name is Ryan Napier. I lead business development for Chorus Innovations. We are a digital health technology company, and we're centered around the idea that healthcare is always local and each system of care is unique. So while each county or region system of care is unique, those core problems usually are not. So disjointed, disconnected technologies make the collection, tracking, and sharing of information across service lines, both internally and externally, it's very difficult. So people are still using phones and spreadsheets and whiteboards and email, paper that track clients across their system. And we know enhanced care management, community support providers all feel this pain acutely. So when you think of Chorus, think of us as a partner. We are not an EHR system. We're here to help build those gaps, fill those gaps with you in that infrastructure. We complement EHR systems. We work with state partners, county partners, and provider clients to leverage our engagement and user experience teams, which marries the expertise of a team of licensed clinical social workers with world-class tech designers to effectively engage the entirety of the populations that will be served by this technology, whether those be users internally or the actual community out that you are serving, to ensure that the technology in their hands is effective and meets their needs, driving effective, seamless, and efficient care coordination. Diagram in our slide shows how these templates work together. And I'd love to share more in breakout room 1.
Thanks so much, Ryan. We can go to the next vendor, which is ClearLink Partners.
Good morning. My name is Karen Van Zandt with ClearLink Partners, and we are an end-to-end consultancy organization specializing in government healthcare programs. Domain 5 and 6 are especially important to me and to ClearLink. I've long believed that communities can only be as strong as the most vulnerable populations, and that there is no one sector in the community that can take on the complexity of being everything to everyone. It makes sense that in order to build truly impactful whole person care ecosystem, that many sectors of the community will need to be involved. We have a depth of experience working with managed care plans, hospitals and healthcare providers, and community behavioral health organizations, as well as community and faith-based organizations. ClearLink is here to help you and your organization realize and fulfill your mission in alignment with CalAIM. And to do that, you need experts who've been on the front lines in healthcare and social services and the government policy discussions that allow for innovative approaches. I was a Medicaid recipient and nearly a maternal health statistic. This is what drives me. Our personal and lived experiences is what drives ClearLink consultants to go above and beyond with our clients and to ensure success. Please join us in breakout room 6 to learn more about our approach.
Thank you so much. Next, we have Collaborative Healthcare Strategies.
Hi, I'm Dr. Amy Boutwell. I'm the founder and president of Collaborative Healthcare Strategies. Collaborative Healthcare Strategies is perfect for Domain 6 because collaborative is in our name. We believe that the foundation to improving healthcare services and supports is cross-continuum collaboration. And for the past 15 years, I've done nothing all day, every day, but help cross-sector collaboration drive results. Primarily been doing this work on behalf of Medicaid recipients. I wrote the book on reducing Medicaid hospital readmissions for the Agency for Healthcare Research and Quality, and that's formed the foundation of a rich fabric of large-scale healthcare transformation initiatives that have driven measurable results. You can see some of the examples of results in small rural hospitals, community hospitals, academic medical centers, measured as reducing readmissions and avoidable ED visits, which we are all trying to do through better services and supports in the ECM program. I'll be in breakout room 5. Would love to meet with you. Thanks.
Thank you so much, Amy. Next, we have Consilience Group.
Good morning, everyone. My name is Juanita Ortiz, and I'd like to introduce you to Consilience Group. We're a purpose-driven, women-owned professional service firm dedicated to the well-being of all people. We focus on helping our clients build capacity to provide cross-sector opportunities for high quality of life through equitable access to essential resources, including healthcare, housing, early childhood supports, education, transportation, food, recreation, housing, justice, and jobs. Since 1999, our firm has delivered training, technical assistance, and direct service for equity-centered assessments, planning, design, and quality improvements to hundreds of organizations, including community nonprofits, healthcare systems, philanthropy, municipal, and state governments across the country. We tailor and we adapt our training and our technical assistance to meet our clients where they are, with tailored solutions for the specific goals and context of your needs. We have a broad and deep experience supporting the nonprofit community, especially community-based organizations of all sizes and levels of capacity. Our nonprofit clients range from national, state, and regional organizations, such as the American Cancer Society, the National League of Cities, Tennessee Blue Care, Blue Cross Blue Shield, to smaller, locally focused grassroots nonprofits and faith-based organizations, often led by people of color. Thank you so much for your time. I look forward to seeing you in breakout room 2.
Okay, thank you so much. Our next vendor is Cope Health Solutions.
Good morning, friends. Good to see you all again. Evan King with Cope Health Solutions, a principal in the firm based here in Los Angeles. Over the past 20 years, we've had a chance to work in the safety net, particularly with the Medicaid and duals populations, both in the state and nationally. Our experience ranges from working with both managed care organizations, community providers, including health systems, CBOs, FQHCs, and others that are coming to the table through community supports. In our work in domains 5 and 6, we're currently working across the state with a statewide carrier, helping to integrate CHWs to close care gaps for those most at risk and high needs populations to help address both equity and quality care gap goals. In the cross-sector collaboration, nationally and across the state, we've led organizing collaboratives to understand and better deliver on driving gaps in care, creating collaborative organizations, and driving common vision and goals for those systems. We work with majority of the managed care plans across the state, as well as health systems and hospitals, thinking about those long-term partnerships and how we move beyond the waiver into our value-based care long-term goals and objectives. Looking forward to seeing you all in breakout room 8. Thank you.
Thanks so much. Next, we have Corporation for Supportive Housing.
Good morning, everyone. My name is Eva Lerner. I'm a senior program manager with the Corporation for Supportive Housing. We are a national nonprofit champion of supportive housing, and we leverage supportive housing to improve the lives of historically marginalized individuals through technical assistance, policy and advocacy, and investment in the field. We've been approved as a technical assistance partner for Domain 6, promoting cross-sector partnerships. Our approach, experience, in TA involves guidance and support in developing cross-sector partnerships across health, housing, homelessness, child welfare, the justice system, and the broader social service sector through off-the-shelf products, including a health and housing and homelessness toolkit, support for data sharing, data systems integration, analysis, establishing referral pathways and partnerships and systems alignment across sectors. And our signature initiatives include our frequent user services enhancement, which is data sharing across the health, homelessness, and justice systems, as well as keeping families together, which is a model that involves child welfare and supportive housing to keep families in one house. We have over 30 years of experience advancing cross-sector solutions to complex health and social challenges, and we always set our equity, people with lived expertise, and communities in our approach. Thanks so much.
Thank you so much. All right, our next vendor is Dawn Chorus Group.
Good morning, everyone. Thanks for being here. My name is Mel Cronin. I am Chief of Staff at Dawn Chorus Group. And really what our motto is at Dawn Chorus Group is doing cool things with cool people. And I think all of us are here because we're really dedicated to health equity across the board. So what we do is we help you take a deeper dive into historical data, current data, your partners that you're working with, internal staff, to really get a full, whole, and all-encompassing picture. And this picture will help, one, tell your story better, but two, help to identify areas of opportunities and areas of great successes. We are very community-based. We build these tools and methods of data collection and analysis with you, not for you, because you know what your business does, you know what your organization needs to accomplish. So we use your expertise and meld it with our expertise. Thank you very much for your time.
Thank you very much. Next, we have Eviset.
Good morning. I am Julie Lawrence, the CEO of Eviset. We are both an off-the-shelf and hands-on provider in Domain 6. Our core team trained at Stanford University in value-based care models, health and social care, and we really love our work with you. We've been here since day one of the TA Marketplace, and we have 22 projects in this domain. So I want to just share 3 things that ECM and CS providers have found valuable in our TA so far. The first is that we have been helpful in providing them customized strategies to maximize cross-sector partnerships. The second is they've seen success in increased referral volumes. And the third, and this is really our kind of our core, is we provide access to our data-driven market intelligence, evaluation, and benchmarking. So what that means for you is it supports you in navigating the landscape of market opportunities and risks for ECM and CS, and it allows you to come to the negotiations table with managed care partners informed and able to demonstrate your value to MCPs. See you in breakout room 5. Thanks.
Thanks, Julie. Next, we have Just Whole Care, which is Goldfinger Health on the TA Marketplace.
Thank you, and good morning. I'm John, and I'm the founder and CEO of Just Whole Care. As a California pediatrician, my career actually began as a navigator, then spanned maternal health, early childhood, all the way to specialty mental health. I've seen the whys behind healthcare maintaining its many structural and discriminatory silos. Just Whole Care was created to advance healthcare for all by connecting and innovating across these fragmented ecosystems, not for fleeting one-to-ones or collaboratives, but deep and complex strategic partnerships designed for systems change. Our dyadic services bring behavioral health and primary care together for kids and families. Our guidance of First 5 improved child development referrals between regional centers, home visiting, schools, and others across Los Angeles. And our trauma-informed networks connect youth with ACEs or other serious behavioral health challenges like suicide or overdose to care. Aside from having worked in so many sectors, our ability to make the money work for all involved sets us apart. Reach out for health equity. We'll be glad to help.
Thanks so much. Next, we have Factor.
Hello, good morning. My name is Mike Wong, a director at Factor, a healthcare consulting company that has supported health centers to care for the most underserved in California since 2001. We have provided ECM support to over 20 different organizations with hands-on custom-tailored projects across 4 domains. We also have a 100% project approval rate in the TA Marketplace and provide free application support. Within Domain 5, Factor's past projects include supporting health equity data collection and validation, developing clinical workflows to close care gaps for high-risk patients, building automated ECM dashboards and patient lists to stratify patients by risk, identify patients for gap closure, and measure ECM's impact on clinical outcomes. We also support with strategic planning by developing community needs assessments to measure and address unmet healthcare needs across service areas, and also develop operational plans to address disparities in clinical model redesign, population health management, and also with staff hiring. We look forward to speaking with you in breakout room number 2.
Thanks, Mike. And we are just about halfway through, so our next vendor is Hansard Health Solutions.
Hey there, can you see me? Hear me?
Yes.
Okay.
Go ahead.
Hello, everyone. Like many of you, I've spent my career building and fixing systems of care to do better. I also manage a chronic condition, and that means I know what it's like to have your health tank and how quickly the dominoes can drop. It's terrifying to lose independence, functioning, and your way in operating in the world. In building new and improved programs, we lift the consumer voice that's almost never in the room when important decisions are made. They are the ones who have so much to gain back and still more to lose. Time is of the essence, and our savvy change agents never forget the high stakes, high impact nature of this work. So I hope you'll join us in room 4. We would love to help you focus your team, focus and unite them on building a system of care that is simple, easy, and organized. That's our wheelhouse. Thank you.
Jessica. Next, we have Health Management Associates.
Hi, good morning. My name is Elvia Delgado, and I'm a principal with HMA. HMA is a national consulting firm that's been around for 40 years. We're a team of over 700 consultants across the nation. In California, we have offices in Costa Mesa, Los Angeles, and Sacramento. And what makes HMA unique is that our colleagues have actually led managed care organizations, delivery systems, and state Medicaid and public health programs. We are very proud to say that we are approved for all 7 domains. And specifically for health equity, some of the services that we offer are our data scientists are really experts in risk stratification and can help you with your population initiatives. We also have a proven track record of developing outreach and engagement strategies that are culturally and linguistically appropriately. And our colleagues not only speak the language literally of your patients, but we also represent many of the underserved communities that CalAIM and ECM and CS are engaged with.
Thank you.
Okay.
Thanks so much. All right, our next vendor is Health Begins.
Hi, everyone. My name is Eva Batayaman. I'm a program manager at Health Begins, and we are a national strategy and implementation firm that serves Medicaid-serving entities to advance health equity for communities harmed by societal practices, and we do this by going upstream and addressing health-related social needs. We support leaders in this space with designing bold strategies, implementing strategic action plans, launching and scaling initiatives, and driving learning and improvement. As a health equity firm, we can support with understanding and navigating CalAIM contracting and implementation requirements, enhancing data collection for equity, strategically leveraging capacity building opportunities, implementing equity-focused improvement methodologies, engaging lived experiences, and enhancing key relationships. And we can work with you to understand your needs and really scope the right mix of these services. And I'll be in breakout room 3. Thank you.
Thank you. Next, we have Innovation Horizons.
Good morning. My name is Lucas Tramatozzi, and I'm a Senior Vice President at Innovation Horizons. We and our partners specialize in integrating highly innovative health technologies and services into sustainable business practices. Our focus is on supporting organizations to be successful in whole person care system delivery, and our team of experts offers a broad range of off-the-shelf and hands-on technical assistance in the marketplace. At Innovation Horizons and Health Policy Matters in Wollomie, we blend clinical expertise with policy insights and technical acumen to provide smart solutions for your complex healthcare challenges. Join us in room 6 to learn about how we can assist your organization promote health equity across your services, whether it be integrating health equity goals into your organization level strategic and operation plans, or receive technical assistance to support delivery of culturally competent care in maternal and child health. And for those who are seeking to strengthen and support cross-sector partnerships, we assist our clients develop and implement effective strategies and partnerships. We educate MCO care management staff regarding the benefits of your CBO services, or we can help you successfully create a culture of collaboration across sectors within CalAIM ecosystem. So our team looks forward to meeting with you in room 6. Thank you.
Lucas. All right, next we have Mayetta Consulting.
Hello, everyone. My name is Katie Mayetta, and I'm the Mayetta and Mayetta Consulting.
If you haven't realized it, but this is the most exciting time ever. The fact that we have the opportunity to change the way we're delivering services is super exciting. And the problem is that we want to do it right, and we need to know how to do it right. And so I have expertise in all of the fields right now. I've been really lucky to be able to coordinate within Santa Cruz County our different entities together. We do sequential intercept mapping. If you're not familiar with that, that helps really identify the gaps within the community. Really, it's a county assessment. That is one thing that I highly recommend with this domain, but we also provide a whole bunch of other services. You can check us out. One thing that we are bringing to the table is that we have an integrated best practice training that is a curriculum we've developed that integrates motivational interviewing, crisis intervention, trauma-informed care, and then also some emerging practices along with crisis intervention. We are now going to be able to offer this in Spanish so that if you have family or if you have teams that really they're bilingual, but their primary language is Spanish, we can actually start using this curriculum. So it can really broaden everybody's perspective. So I will be in breakout room number 5, and I look forward to seeing you.
Thanks so much, Katie. All right, our next vendor is Partners in Care Foundation.
Hello, everybody. My name is Esther Safilian, and I welcome you to learn more about Domain 6 on cross-sector partnerships provided by Partners in Care Foundation, which is a California social care community-based organization and community care hub, with Partnership to Align Social Care, which is a multi-stakeholder national learning and action network, which we bring you a local and national subject matter experts in providing technical assistance on cross-sector partnerships with a focus on how hubs link those partnerships with local community agencies and providers. Community care hubs have years of experience in working and contracting with an array of healthcare organizations, including payers such as health plans and provider groups, health systems, and hospitals. Hubs support community agencies in serving more individuals in their communities by allowing them to focus on what they do best, provide the patient member care, while hubs handle the administrative functions and business operations, such as billing, contracting, business development, IT, capacity building, workforce development, and linkages to other CBOs, and which breaks silos. We have been influential in supporting the CalAIM initiative. Please join us in room 4 to learn more. Thank you.
Thanks, Esther. All right, our next vendor is Primary Care Development Corporation.
Good morning, everyone. Primary Care Development Corporation is a 30-year-old nonprofit that specializes in doing everything we can to increase equity and access in primary care. We are a national organization, and I lead the California West Coast portfolio of business. We are approved for Domain 5. Our work in the health equity space within CalAIM has involved a lot of team-based work and team training. So we do trainings around trauma-informed care, around understanding and working through implicit bias, motivational interviewing, and a number of other things that really help to build an understanding around what equity is and how to increase equity and access. I will be in breakout room 3. Look forward to seeing everyone.
Thanks, Christina. Next, we have Rocket Doctor.
Hi, everyone. Good morning. My name is Ashley Kirk, and I'm here on behalf of Rocket Doctor. So Rocket Doctor is a platform and a marketplace that integrates AI field software with Bluetooth-enabled medical devices to match Medi-Cal patients with the best clinicians possible. So in terms of our TA marketplace services, we can partner with systems of care to be an extension of added capacity to expand access through our network of primary care specialists, behavioral health physicians, through virtual care. We can also work with public hospitals and other health systems to expand access through ED diversion strategies. So in the last 12 months in California, we've powered over 6,000 appointments, connected over 300 plus Medi-Cal patients, have connected dozens of those Medi-Cal patients to community health workers as that's part of an integrated service within Rocket Doctor. Please join me in breakout room 1, and I'd be happy to elaborate and talk more. Thank you so much.
Ashley. Next, we have Serving Communities Health Information Organization.
Good morning. I'm Dan Chavez, Executive Director of SCIO, located in Santa Cruz, California. SCIO is one of the oldest HIEs in the country, the oldest in California, and recently named to be a QHIO. As such, we can satisfy all of your data sharing requirements and satisfaction of both CalAIM and the Data Exchange Framework. We aggregate data, integrate it, present it, control the access, curate the data, and make it generally better for all in the ecosystem. We're firmly committed to presenting total or whole person care and all the required information as such. We are an HAE, a CIE, a community care hub in our communities. We support the health data utility model, and I look forward to discussing more with you in breakout room 5. Thank you.
Thanks, Dan. All right, next we have Sherry Brenner, Health Systems Consulting.
Thank you, Jenna. My name is Sherry Brenner, and I've been doing public health work on the ground for over 30 years and in Northern California for over 20. I think many of the services many of us offer are similar, so I'm going to focus on the why. I think the vision of CalAIM is brilliant, and these two domains really bring it all together. Health equity is why we're here, and it requires us to do the right work to thoughtfully repair the damage the system has perpetrated on communities of color and other disenfranchised communities. Cross-sector partnerships are crucial because we can succeed when we all work together, and none of us can do this alone. While we're talking about domains 5 and 6 today, we clearly need accurate data for decision-making and the right workforce to do the right work. This is all interconnected. So starting wherever each of us is at right now, let's do this thing together and begin to repair some of the past harms. I will be in breakout room 7 and look forward to a lively discussion. Thank you.
Thanks, Sherry. Next, we have Social Finance.
Thanks, Jenna. And hi, folks. I'm Ryan Erickson with Social Finance. We're a national leader in outcomes-based contracting and really specialize in building partnerships across different sectors oriented around outcomes and equity, and specifically centering participant voices in the contracts we build. In particular, we've had a lot of experience helping governments and providers establish contracts that work well mutually on both sides, and again, centered on outcomes, achievable metrics that indicate a program is a success. In breakout room 4, look forward to talking with you more there.
Okay, thanks, Ryan. All right, next we have Homebase, which on the marketplace is the Center for Common Concerns.
Thanks, Jenna. Hi, everyone. Good morning. My name is Jillian Marchetti. I'm a directing attorney at Homebase, and I did check. If you search Homebase, it does still come up, even though we are listed, yes, as Center for Common Concerns. Thanks, Jenna. We're a nonprofit dedicated to focusing on helping communities build their capacity to reduce and end homelessness and to connect folks experiencing homelessness with the resources they need to improve their housing and health outcomes as well. I'm one of the co-leads of our healthcare focus team, which has for the last over a decade been focused really closely on helping connect homeless response systems and individual programs with healthcare systems. And we've done a lot of work in the last couple of years, specifically connecting COCs, which are the homeless response systems around the state, to managed care plans locally, to help them improve their connection of folks experiencing homelessness to community supports and enhanced care management and other CalAIM resources. So I'm really excited to talk to folks. I'll be in breakout room 6. Thanks for having me.
Thank you. All right, we're down to our final 3, which the next one is Therapeutic Play Foundation.
Hello there. Good morning. My name is Nakia Fields, and I'm a licensed clinical social worker and founder and executive director of Therapeutic Play Foundation. We are enhanced care management providers currently. We have lived experience as both providers, myself as a LCSW, but also consultants. For the past few years, Therapeutic Play Foundation has taken lead as the backbone organization for the Black Mental Health Task Force. And one of our missions is health equity and access for communities of color in particular. And what we've done is gone out in the community and built partnerships, not only with other CBOs, but managed care panels, other community, larger organizations like Planned Parenthood, because we focus on the mother the child and the whole family unit, and the ability to think clearly, make great decisions for yourselves to empower a healthier future, as well as taking care of yourself, going to the doctor. And this is a systemic issue due to mistrust in certain systemic spaces. And we want to step into the gap to build a pipeline into healthcare access. So we want to develop a needs assessment. Will move us all forward, and meet us in breakout room number 2. Thank you.
All right. Next we have Transitions Clinic Network.
Hi, everybody. My name is Anna Steiner. I am excited to be here on behalf of Transitions Clinic Network. We are a nonprofit organization that has been transforming health systems to better serve individuals returning from incarceration since 2006. Our work is really centered around engaging a population that has been traditionally, if not completely excluded, mistreated by the health system. And so our work really centers around improving the health and reentry outcomes of individuals returning home and employing people with lived experience within the healthcare system. We offer a variety of services, including a full systems transformation package for clinics. Feel free to come and join us in room 1. I'll be joined by my colleague in that room as well to learn more about the services we offer. Thanks so much.
Thanks, Anna. All right, and our last vendor presenting today is True Management Services.
Hi, everybody. Sergey Shkurkin, founder and CEO of True Management Services. We've been in the CalAIM space since 2021 and a vendor since 2023, currently assisting 28 agencies with over 100 approved projects. We have 15 off-the-shelf products across the domains. And our domain 5 offering is promoting health equity via social determinants of health. We identify the 5 pillars of social determinants, describe the difference between health equity and health equality, and understand the implications of implicit bias and unconscious bias on health service delivery. This kind of training is required by all the MCPs for their contracts. You guys probably know this. And if you haven't done this, we can help you meet that requirement, but also learn a lot about this stuff. Join us in breakout room 3. Hope to see you there.
Thank you so much. And a big thank you to all of our vendors today. I know it's not easy to give that 60-second pitch, which is why we are going to be moving to our breakout rooms. So if we go to our next slide. All right, just a little bit about logistics regarding the breakout rooms. So I'm going to take this opportunity again to make sure that you have the Zoom application downloaded to your device to ensure that you are able to successfully participate in the breakout rooms. So if you've joined by phone or browser, please rejoin the Zoom meeting at this time. So as I was stating previously, breakout rooms are really an opportunity for attendees to ask questions of TA vendors and really hear that more granular detail about their projects and services. Once you move into the breakout room, we ask that all attendees use the raise hand button at the bottom of your screen to raise your hand to ask a question. A member of the TA Marketplace team will be in the breakout room with you, and we will call on attendees individually with the hands raised and ask that they come off mute to ask their questions. We do ask to minimize background noise, that if you are not asking the question and have been called on, to please remain muted until you have been called upon. We will be sending out some messages and reminders that breakout rooms will be closing at like the 5 and 1 minute marks, but we will be rejoining the main room at 10:15 Pacific time. All right, so if we go to the next slide. So attendees will be automatically assigned to a breakout room. Vendors will be entering their assigned breakout room on their own. So once you are in an assigned room, attendees are able to move between breakout rooms. So if there is a vendor that you would like to speak with, you are able to move around in those breakout rooms. And here are some directions on how to do so. So you will see on the screen in the breakout room, we will share where each of the vendors are located. So once you've identified the breakout room that you would like to join, just click on the breakout room button again at the bottom of your screen. Identify the breakout room number that you would like to join associated with that vendor, and you'll just need to click join and you will enter that breakout room. There will also be instructions on how to do this in the breakout rooms themselves, should you have any questions or concerns. Next slide, please. All right, and here we are. We have our TA vendor breakout room assignments. There are 8 breakout rooms, and again, we have 29 vendors here with us today. Again, this will be in all breakout rooms, so do not worry if you are not sure which one to join. You'll be automatically put into those breakout rooms. And that being said, Danielle, I think we can begin to open those breakout rooms and have folks start to join.
Awesome. All right, here we go.
Thanks so much. All right, and so vendors, if you can just go to your assigned breakout room and a member of our team will join you there.
Thanks, everyone. Please let me know if you're having any difficulties. Courtney, always a good sign when it's just you and I left in here.
Totally agree.
Awesome.
I'm gonna share that other slide in just a second. We will be good.
And while Courtney is getting that main slide to screen share, if you are stuck in this room with me, it does mean that you were not automatically pulled into a breakout room, which could be due to how you joined if it was not through the most updated and downloaded version of the Zoom application. So if you're able to join the breakout room, if that sign came up for you and you can go ahead and join, please do. But everyone else was automatically pulled in there. So if you're having difficulties joining, it might be how you joined. In the meantime, please feel free to ask any questions by utilizing the Q&A chat. I'm here to answer any questions at all. And we will be able to reconvene in this main group session at 10:15 Pacific time, 1:15 Eastern to go over the final Q&A. So if you're unable to join a breakout room due to the settings, please hang tight. Feel free to ask any questions in the chat. And at the quarter after mark, everyone else will be back here and joining us.
Thanks, everybody, and welcome back. I see we are recording, so thank you, Danielle. All right, so I hope everyone had a great session with all of their different vendors. All right, so I think I'm going to start with actually some TA Marketplace updates and resources before we jump into the Q&A. So if we go to the next slide. Just want to give you guys all a high-level overview of the TA Marketplace homepage. So you can visit our homepage here. Provides a lot of great information about different vendors, the project types available, these different domains, so domains outside 5 and 6, and then really how to get started in becoming a TA recipient. We're also excited to share under our resources on the homepage, we now have modeled project eligibility applications available. So if you're wondering about how to get started in running one of those applications, which is the first step after you become a recipient, please check that out. We'll be sharing that as part of the meeting materials following today's session, and also have some marketing materials about it. We can go to our next slide. So vendor profile cards, I know I spoke a little bit about this in my breakout session, but if you're really looking to hear a little bit more about any one of the vendors that we talked to today, you can find them on our website by navigating to the vendor side or the marketplace using the Find a Vendor. Here we've got Cope Health Solutions. It provides a brief overview of their organization, the different domains that they're approved for, and their contact info. But if you really dive into each of these vendor profile cards, you'll then see the full profile, which has more information about their organization and services, as well as some of those client testimonials, so you can hear from other organizations about their experience with this particular vendor. So if we go to the next slide, go a little bit more into the marketplace. So if you're ready to kind of start looking at what the different offerings are, whether that be our vendors, the vendors off the shelf projects, so those are the kind of ready-made projects for recipients, you can click Explore the Marketplace. This appears at the top of every CA Path website page. So if you navigate there, it'll bring you right to the marketplace. If you click on an off-the-shelf project, so you'll see here, we have technology procurement management. You'll see under that the domain for which it's approved. So that in this case, domain 4, enhanced care management. You'll see the typical duration for the project, as well as some of the project objectives and who is providing this project. But if you click into it, you'll hear a lot more about those project objectives, key components, deliverables related to this project. So if you have an idea of what type of TA you're looking for, the off-the-shelf projects might be a good place to start. But again, if you're looking for that more curated type project, you can select hands-on projects and work with a vendor in the approved TA domain for which you're looking to receive TA services. If you go to the next slide, we have just a brief overview of the TA marketplace filters. So again, if you've kind of got an idea of your TA needs, we have added filters to the marketplace as of January of this year. You'll see that there are filters for the different domains, project types, but then we actually have it by like technical assistant needs. So if you are someone that is looking for help with HIPAA compliance, we have a TA filter for that. If you are looking for help with a specific ECM or community support services, such as asthma remediation, we have a filter for that. We also have some filters for different populations of focus and several other categories. So be sure to take a look there. And then if you were able to find a great fit with a vendor today, you can, again, use that Find Vendor feature available in the TA Marketplace, and that will navigate you to their vendor profile card and their actual profile, so you can see all the services that they have available. All right, so if we go to the next slide, our last slide is just about how to become a TA recipient. So several different entities are available to become a TA recipient, but I will just flag that the marketplace itself is actually public. So if you are not yet a recipient, you can still browse the marketplace, you can see the different vendors, you can see their projects, and get a kind of a good idea of what you might be interested in. When you're ready to apply to be a recipient, these are different entity types. But again, if you are unsure if you would qualify, feel free to reach out to the TA Marketplace team. And then we will just have you fill out different documentation based on your contracting status with a managed care plan. So if you are contracted with a managed care plan, we are going to ask that we receive a copy of the signed contract page, just showing that you are contracted with an MCP. If you are not yet engaged, but you are, in conversations with a managed care plan, we would ask that you download our attestation form and have both you as a recipient and the managed care plan sign that form. And then if you are not yet engaged with the managed care plan, and this is actually what you need the TA Marketplace for, do not fret. We do have a way in which you can be approved by DHCS. So that is this little pop-up here. We just ask that you provide a little bit of information about your organization and send that email request to the TA Marketplace team, and our team will present it to DHCS. Typically, we're getting these approvals in about a week or so. So be sure to apply or email us if you have any questions about your eligibility to become a TA recipient. All right, and I am going to move to the next slide where I think I'm going to pass it to my colleague, Trish Parazelli, to kind of lead our Q&A. So feel free to use that Q&A box at the bottom of your screen to ask any questions that you might have about the TA Marketplace, specific questions about the application process. We're happy to use the next several minutes to answer those questions.
So I think this is the first time this has happened, Jenna. There's no questions yet in the chat. We must have just had really, really productive breakout rooms so far.
Trish, I can go over 2 questions that came in earlier in the webinar, if that works to kick us off, and then hopefully folks can put some in the chat. So one of the questions was, can the recordings of the vendor fairs be available? We're in the process of editing and uploading these to our site, so they will be uploaded within the upcoming weeks. This will be all 5 of those vendor fairs along with supporting materials. And then the other question that came in was where the vendors are geographically located. So we suggest you going to the TA Marketplace website. I have linked the link there in the answered questions, and looking under each of the vendor profiles. Often vendors do put where they are headquartered, but also their links to their direct websites can be found there as well for more information. And I think that might have done the trick because Trish, 1 question came in for you.
Yeah. Ooh, 2 now. I love that. Okay. So, all right. I love it. They're all coming in now. Okay. So our applications still accepted ongoing with no specific deadline? Yes. There are no open and closed periods for submitting TA applications. So if you need TA, you can request it today, tomorrow, next week. That is no problem. So if you're approved, so another question, if you're approved by DHCS, how long does the other application process take? Well, so if you've got your option 3 attestation signed and you upload it through the recipient eligibility application process, it should be approved in less than a week. And the project eligibility process, the next stage, so you select your project and your vendor, that typically takes 1 to 2 weeks, 2 weeks probably, I think at this point, because we've had a lot of applications. You know, as long as there's no rework required, you can move on to the scope of work and budget process immediately. So we've had some projects that go from recipient eligibility to execution in less than 30 days, actually, in the last few months. So, you know, that's always exciting, but it mostly depends on a complete and accurate application coming into us for review, and then a approvable scope of work and budget first round without, you know, multiple rounds of re-edits. For the application process, which is preferred, email or the DHCS portal? So unless you need a option 3 attestation form, as Jenna described, so you are not currently talking to a managed care plan or working with a managed care plan, and you need DHCS to approve specifically you as a eligible recipient, you're going to go straight to that DHCS portal. So straight to that online application and submit your attestation with your managed care plan. And you don't need to email us at all unless you want to. We love hearing from you. But you know, if you do need that option 3 attestation, that is through contacting the TA Marketplace inbox. And I love this question. I love answering it. Can you work with multiple vendors and different TA projects? Absolutely. We encourage it. So we really want to make sure our recipients get exactly what they need. And if that means working with more than one vendor, then that is what you will do. If it means multiple projects over time as your needs evolve, so you might do an assessment first to figure out what you need. And then from there, you might realize you need billing help, you need community-based support, you need all kinds of different types of support that a vendor can provide. You might find you can get it all from one vendor or just from from multiple vendors. It's really whatever these recipients need. We're doing our best to connect you with the resources that are most appropriate for your organization. And I see Dan has his hand up. So Dan, do you want to ask like the last question?
Well, no, I just want to clarify, Trish, you can work with multiple TA vendors on the same project, right? It's not, just to clarify.
Yeah, so we've had some scenarios where multiple vendors will work together on the same project. So one vendor will be the lead vendor and they'll work with another vendor. And we're seeing a lot more of that recently as we have some vendors who have such strong expertise with a certain population or community. But we have other vendors who've really done very specific work around process. And so those vendors will partner together and they'll be able to deliver the best possible product for the recipient. So, you know, there's a lot of different ways that TA can be delivered through this marketplace. And it's really, you know, if you can come up with something that you need, we will probably find a way to get it to you, as I think the takeaway. Oh, good. Is there a limit to the number of projects a provider can apply for? No, there is no limit. The limit is your ability to receive that TA in a meaningful way. So, you know, if your organization has the bandwidth to act with the vendor on this TA, right, to receive the TA, to integrate it into your practices, then you can request that TA. We're not putting any hard caps on the number of times an organization can apply. We just want to make sure that all of these organizations get what they need. All right, we might have answered all the questions, but we do have a couple more minutes. So if something pops into your mind, definitely put it in the chat.
All right, thank you, Trish. And I think we can probably move to the next slide, where we are just requesting your feedback on the vendor fair. So this survey will be sent out today to all registrants, attendees, or you can access it using the QR code. We would really like to hear your feedback. This not only helps us, improve events like these, it helps us identify needs and improve the TA marketplace as a whole. So we'd greatly appreciate your feedback on this event, or if you've attended any of the other events, that feedback is greatly appreciated. All right, and I think if we go to the next slide, in case anyone does not have it, here is our contact information. We tend to respond to the emails very quickly, so we do encourage you to contact us via email. So it's the TA-marketplace@ca-path.com. And not seeing any other questions in the chat, noticing the time, I think I will just take this opportunity to thank you all for joining us today. Thank you again to all 29 of our great vendors for presenting, joining the breakout sessions. We greatly appreciate it. And we hope that you are able to have fruitful discussions and hope to see your applications come through. So thank you, everyone. I hope you have a good rest of your day.
Thank you.